Lack of proper maintenance of the environment has been the major cause of many diseases across the country. In May 2010, Nigeria recorded the worst cases of cholera the country has seen in 20 years. Over 800 people were reported dead, thousands were infected, and millions were put under threat. Early this year, the northern part of the country again witnessed a serious outbreak of cholera.
I think in terms of access to water and sanitation, we could do it. Much more collaboration at the local level. A lot of education needs to be put in place because that clearly is a deficit when it comes to sanitation. You mentioned the outbreak of cholera. That's a health education issue, collaboration between health and education ministries and ensuring that primary health care is better delivered. So I think that the goal for water and sanitation, looking at mitigation and adaptation with the environment, is on track. I think we will struggle with the slums that we will have to reduce because by and large we see many of them increasing. But there are reasons for that. If we continue with the investments in infrastructure and see the connection between the impact of those on poverty, then we should begin to see a reduction in that aspect of the goal.
Cholera is a waterborne disease and can also be transmitted by food that has been in contact with sewage. It causes serious diarrhea and vomiting, leading to dehydration. With a short incubation period, it can be fatal if not treated on time. However, in Nigeria, in trying to make an ends meet, many are exposed to dangerous environmental hazards. In our previous episode, we brought you the story of how able-bodied youths scavenge waste dumps around the cities seeking a livelihood. They say they make just over $100 monthly from 20 kilos of different disposable wastes, selling to companies who recycle the materials. Some of the materials, like electric cables, are burned to get the copper, thus exposing the boys to poisonous materials. The government does not want them here and are now thinking of ways to do what they do in a safer way. These people are aware that the government is against this practice, but they claim they have to make a living to look after their families. This is what one of the scavengers had to say.
We face government challenging because government not allow us to do the work.
The MDG's office, other government agencies in the private sector are now seeking to establish sanitation inspection officers in rural communities to enforce local sanitation laws and community cleanliness. Nigeria's rich environmental resource base is being undermined by unsustainable practices. Deforestation is high, about 3.5% annually, and being encouraged by use of fuel wood for cooking, a common practice in Nigeria's rural areas. Oil companies pollute water in the Niger Delta, while gas flaring, though on a declining trend, still remains high. Access to safe drinking water and sanitation is improving, but housing has reached a crisis point with only 31.1 having secured tenure.
Through the process of urban renewal and storm upgrading, we are also involved in the provision of basic infrastructure in the neighborhoods to improve the deplorable housing conditions. Our program currently on slum upgrading includes the provision of the development of roads, water supply, electricity. We're also building modern markets in most of our congested cities so that there is a better level of upgrading to enable the cities come up to a good level.
If we continue with the investments in infrastructure and see the connection between the impact of those on poverty, then we should begin to see a reduction in that aspect of the goal.
The culture to keep the environment clean is gradually catching on. While Nigerians in local communities take direct responsibility for their environment by keeping it clean as a household chore, those in big cities are held by government who have employed thousands of street cleaners. They are seen in the early hours cleaning major streets every day.